Hey guys, welcome back to Buying the Pharm. This is Johnny with SoCal EMS, and today we're going to be going over albuterol sulfate, also known as Ventolin. So this medication is going to be a strong bronchodilator. It's a sympathomimetic, and it stimulates the beta-2 adrenergic receptors. So our beta-2 receptors are in our lungs. So when we say beta-2, think 2 lungs. The way this medication works is it's going to stimulate the beta-2 receptors in the lungs, causing smooth muscle relaxation, which allows the bronchioles to relax and dilate. The types of patients that are going to have this medication prescribed to them are going to be our asthma patients, COPD patients, or chronic obstructive pulmonary disease, and in the emergency setting, it could be used for allergic reactions or anaphylaxis. The way that asthma affects the body, it's a 3-pronged attack, meaning it causes inflammation, bronchoconstriction, and increased mucus production. As far as COPD, this is an umbrella term for emphysema, which is the breakdown of our alveoli, and or chronic bronchitis, which is a chronic inflammation of our bronchioles, which makes it harder for our patients to move air in and out of their lungs. So the way that albuterol is packaged, it can either be in an MDI, which is a meter dose inhaler, or it can be administered through a small volume nebulizer, or SVN. The MDI is going to be a handheld device prescribed to the patient from a doctor, and it's a small canister that is going to administer a specific dose to the patient for each puff that they puff their MDI. Generally, the single puff is about 90 micrograms of the medication, and this is also called a rescue inhaler. Your small volume nebulizers, or SVN, is going to be a device that has to be attached to compressed air, which is then going to aerosolize the medication for that patient to inhale it. So there's a couple different types of small volume nebulizers out there. We have a handheld nebulizer, and we have a nebulizer mask. As far as med administration, the patient's going to have plastic vials of their medication. A typical concentration is going to be 1.5 milligrams of medication in 3 mLs of fluid. And a typical dose for your albuterol is going to be 6 mLs of albuterol or 3 milligrams. So they're going to take the vial of medication and pour it into a canister that attaches to the nebulizer. They'll plug an oxygen tube to the canister and aerosolize the medication for it to then be inhaled. We also have to remember that this is a sympathomimetic, so it's going to stimulate the fight or flight side of our autonomic nervous system. So it's not uncommon for these patients to become a little jittery or slightly tachycardic. So the indications for this medication is going to be a patient who has shortness of breath with suspected bronchoconstriction or bronchospasms. So as the bronchioles are constricting, it's going to manifest itself in the form of wheezes. Wheezes are a high-pitched musical whistling sound, best heard on exhalation. And depending on the severity of the patient's shortness of breath, we can hear an audible wheeze from across the room as we approach our patient. So now we're going to get into the SoCal EMS Pharm sheet test. Meter dose inhaler, MDI, small volume nebulizer, SVN, class, sympathomimetic, dose, determined by medical direction, MDI, 1 puff delivers precise dose, SVN, dose delivered over 5 to 10 minutes, route, inhaled, action, activates beta-2 adrenergic receptors to relax bronchial smooth muscle. Bronchodilation relieves bronchospasms and reduces airway resistance. Onset 5 minutes. Duration 3 to 4 hours. Indication shortness of breath with suspected bronchoconstriction. Physician prescribed meter dose inhaler. Medical direction approval. Contraindication: patient not responsive enough to use MDI or SVN, not prescribed to the patient, patient has taken already maximum dosage prior to arrival.